All right. Y'all already know who it is. It's your girl Ash, and thank you for tuning in to another episode of Black Girl Interrupted. So it's so good to see you. I hope everyone has so far having a good week. I know it's only Tuesday, but I definitely want to say again, shout out to all the mothers on Mother's Day. Oh my God, I love you ladies. I appreciate you, and I hope you had a great day. So y'all already know before I jump into tonight's episode, y'all already know I got to do my mental health check in. So you already know, drop in the comments. Let me know how you feeling tonight. I want to know how you doing. Let your girl know. Drop in the comments. So while I'm waiting on all the comments to start rolling in, y'all already know I got something beautiful for y'all that I have to play before I even jump into tonight's show. Hey, cuz, I love you too, babe, and I hope you had a great Mother's Day too. So y'all already know. Y'all know I roll videos and I bring clips. I do everything. So before we even get started into tonight's topic, I definitely want to drop something for anybody that's going through something right now in this moment. So let me go ahead and let me drop this for y'all.
I don't know who this video was for, man, but it's like 4 a.m. in the morning, May 10th, and my heart is heavy because I know there's somebody out there that is ready to end their life, that's already made up in their mind that they're not going to fight no more. They're tired of fighting. They don't have no more strength to find because they've already gave all their strength. They don't have the strength to turn the page. They don't have the strength to see tomorrow. They made up in their mind that their life is over. And maybe they logged on to Facebook. Maybe you logged on to Facebook and looking for a sign. Maybe you logged on to say your goodbyes and you came across this video. So I just want to tell you, man, that don't let those thoughts that are trying to kill you kill you. Those thoughts that telling you life is over, those thoughts that telling you you're not enough, those thoughts that tell you things won't get better, those thoughts that tell you that you are your mistakes, those thoughts that tell you that you are your past, those thoughts that tell you that you're worthless. Don't let those thoughts kill you. They're lying to you. Because you're more than that. You're more than a conqueror. You're more than what you're going through. You do have purpose. You are awesome. You are talented. You are beautiful. You are special, despite what you've been going through. So you make up in your mind right now. Okay, you don't have to have a whole plan out for the rest of your life. You make up in your mind right now that you're going to fight with faith tonight. You make up in your mind right now that you're going to survive tonight. Whatever it takes. I pray that you have a peace in your mind that floods your mind like never before, to let you know, despite everything that you're going through, the storms that you're going through, the flood that's flooding your life with pain right now, I pray that peace tells you that everything is going to be okay. I pray that you find the strength inside of your weakest moment right now that lets you know that everything is going to be okay. So you put down that gun, you put down that drug, those pills, you put it down, man. Because there's more to your life than what you're currently going through. And you'll never understand it if you quit right now. But I promise you, if you fight with faith, you fight with prayer, eventually you'll realize everything that you went through had a purpose. Everything that you went through had a purpose. Life will get better. But if you end your life, you prevent it from getting better. All right?
Whew, so y'all do know that it is Mental Health Awareness Month, and you guys know that I talk about mental health all the time, regardless of what month it is, because, like I say, right now mental health is at an all-time high in the Black community. So before I even jumped into tonight's episode, I definitely wanted to drop that because I wanted someone to know that if you're going through something, talk to somebody. Please reach out to anybody. If you feel like you are alone and you don't have anybody to talk to, please reach out to the Suicide Prevention Lifeline. Please, please, please take note of this phone number, write it down, take a picture of it, call it. It's anonymous. You don't have to disclose who you are. If you just, like I said, you need someone to talk you down off that ledge, please reach out to somebody. Please contact anybody. Even if it's not suicide, if you are just in a mental health crisis, here's another phone number. Please reach out to somebody. Please let us help you. Y'all know my DM is open. Excuse me. You do know if you have my phone number, call me. Let's talk about it. Let me help you work through your day. Please, 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 please. Let's erase the stigma around mental illness and let someone know that it is okay to talk to somebody. Just because you talk to a therapist does not mean you are crazy. So I want you to know that. I want you to always remember that. Also, another picture I want to post up really quickly. Suicide is not an option. Call me anytime. So if you feel like you're going through something, and again, you don't have anybody to talk to, you don't have a way to turn, if writing is not easy for you, excuse me, please send me a message. Please call me through Facebook, whatever it is. I want to be the person to help talk you down off the ledge. I definitely want to say I love you guys. And again, whatever it is you're going through, you're going to be okay. You're going to pull through. It's going to come out all right. You're going to come out victorious. I do want to say this. If you are a person that is considering suicide, people do not take mental ill people seriously. Stay with them, help them remove all lethal means. Call the National Suicide Prevention Lifeline. The phone number is on the screen, 1-800-273-8255. If you cannot talk to anybody, please text 741-741 to speak with a trained crisis counselor from the crisis text line. It is free and it is available 24/7. All else fails, please escort them to a mental health service or take them to an emergency room. Please help to save a life. I can't stress it enough. Mental illness, like I say, is at an all-time high. Whether you're depressed, whether you're dealing with anxiety, whether you're dealing with those suicidal thoughts, whether you're dealing with PTSD, whether you're dealing with schizophrenia, whether you're dealing with bipolar disorder, there is help available to you. Please don't feel like you are alone. I am speaking from a person that suffers from depression, a person that suffers from anxiety. There are those days that I feel like I don't have anybody, but I have actually reached out to the Suicide Prevention Lifeline to speak with someone in regards of being talked down off the ledge. So again, keep dropping in the comments. I want to know how you're feeling. How was your Mother's Day? How's just your everyday? How are you feeling today? How did you wake up today? I want to know that. So y'all drop in the comments. Let me know how you are doing. And again, shout out to my cousin. I love you too, Brenda. And thank you for tuning in tonight. God, I love you guys. So again, y'all already know before I jump into any of the topics, I always want to let you know how I am doing. Um, I will say today I woke up better. I got up, I opened my blinds, and I let some sunshine in today. I got me a little vitamin D. Uh, ran a couple of errands and then came back home. But Mother's Day was actually great for me. And again, you guys know that I do not celebrate Mother's Day because I'm a mom every day. But I do want to shout out my kids for coming through. They did make Sunday easier for me. As many of you know, again, and I talk about it all the time. I lost my father back in March, so this was actually my first Mother's Day without a phone call or a text from my father. So it was a little tough for me, but shout out to my kids. They are the true MVPs. They came through in a clutch, and they made your girl feel special. And also want to let you know, in regards to our relationship, this was the first year they had bought me a Mother's Day card in, oh my gosh, 10 years. But I'm forever grateful. And I do treasure the small moments and not so much the big moments. So y'all keep dropping in the comments. Let me know how you doing again. Y'all know I do my mental health check-in. So I want to know how you feeling. So jumping right on into tonight's topic. Tonight we are talking about infertility. I want to be somebody's mother. Gosh, gosh. The things that we go through as women, the things that we go through in regards to being mothers. Again, these are conversations that we have to constantly have. We have to continue to push and put these unbearable, uncomfortable conversations and push them to the forefront. Infertility is actually really high in African American women, and there are a lot of resources out there, a lot of options out there that we do not take advantage of. So, infertility. I want to be somebody's mother. If you or someone you know that has experienced infertility, drop it in the comments. Let's talk about it. Let's unpack those suitcases. I want to know how you're able to deal with it. You know, were you born infertile? Did something happen for you to be infertile or sterile? I'm so sorry. Infertility is the inability to conceive. But again, there are options out there. So, excuse me, let's jump right on in. Infertility, what is it? What is infertility? So again, y'all already know I come with videos with informative information in regards to, to any topic that I'm discussing. So this right here, it says the stereotype that Black women don't have fertility issues is persistent and harmful. Actually, it says in our survey, Black women were more than 50% more likely than white women to say that they felt uncomfortable talking to their doctors about fertility. So again, we have to remove that stigma, and we have to be open when it's time for our well woman exams once a year. Even if you go, and it doesn't necessarily have to be a well woman exam, but anytime you're trying to conceive, it's good to go and speak with your doctor, and please be open and honest with them, and let them know the issues that you're having in regards to trying to conceive. So exactly what I said I wanted to do, I want to break the stigma about Black women and infertility. So again, here is an informative video, again, to inform you guys exactly what infertility
Hi, I'm
is.
Dr. Jackie, and you're watching MadameNoir.com. About 16% of white women will actually seek out fertility treatment between the ages of 25 to 40. Crazy enough, only half of African American women will actually go and see the doctor. So the first thing is, if you've been actively trying to get pregnant for more than 12 months or 12 months or greater, that's infertility, and you need to see somebody. The other big cause we see in the African American culture is fibroids. You know, more than 50% of Black women have fibroids, and with that, it impacts fertility. Whether it's you've had to have multiple surgeries, it's blocking the cavity or the tubes, you can't get pregnant, it's a problem. We eat poorly. And, you know, I try and give it a little bit of credit in that as the cultures have evolved, we were only given the bad foods, and we had to learn back in those days how to make food taste good, and we put butter and lard, and so it's a evolution that should be changing where we eat better. But eating poorly leads to obesity, and the more obese you are, the more your body makes hormones, estrogen in particular, and you're walking around, you're not ovulating, so you don't get pregnant. Exercise is important. Women who work out have better sex, they have more energy, they lose weight, you secrete great hormones called endorphins, and you feel better. Don't be ashamed. It's happening a lot more. Well, it seems like it's a lot more in the white culture because they go to the doctor and they actually report it. It is very prominent in the African American race. We just don't go to the doctor. So don't be ashamed. And I'm just going to add, we use religion sometimes as a band-aid to say the Lord will make a way. When He's already made the way, He just needs you to walk down that path.
All right. So jumping back, so infertility. Exactly what is infertility? So infertility means not being able to become pregnant after a year of trying. It says if a woman can get pregnant but keeps having miscarriages or stillbirths, that is also called infertility. And as you know, last Thursday, I'm sorry, I did an episode on stillbirths, and then I did an episode on miscarriages. So infertility, what is it? Why does it happen? And why is it so high amongst black women? Drop in the comments and let me know your thoughts and let me know, what do you think, your thoughts on infertility. Again, if you or someone you know is dealing with infertility, let's talk about it. Don't be embarrassed. It doesn't mean something's wrong with you. Let's talk about that. All right, so jumping into this question, what are the leading causes of infertility? So as Dr. Jackie stated, the issues, the leading causes of infertility, as stated, it could be a hormone imbalance. You could have a tumor or a cyst, something that's blocking the fallopian tubes. You have an eating disorder, such as anorexia or bulimia, alcohol or drug use, stress, excess weight. You could have thyroid problems, or the intense exercise that causes a significant loss of body fat. So going back, I've never dealt with infertility issues, but I have, like I said, I suffered two miscarriages um, within 2 years apart. So one of the things, so I asked the doctor, I was like, why? Why did this happen to me? And she said, well, number one, I was a little underweight, is what she told me. Underweight. I was still smoking, um, drinking. Hey, love, how are you? Good to see you. Thank you for tuning in. So, um, another reason the doctor told me that I possibly could have suffered the miscarriages was due to chromosomal abnormalities. So again, I suffered, like I say, two miscarriages, and then eventually, gave birth to my last and final baby, who is now 11. So that's my rainbow baby. But I was reading some information in regards of like the leading causes of infertility. So let me go back. Y'all give me a second. And sometimes it's not always the woman. So keep in mind, it's not always the woman that's infertile. It can also be the men. So men, if you and your spouse or your significant other are trying to conceive, go see your doctor. Do your sperm, get your sperm count checked. Make sure you're eating right. Make sure no drinking, no smoking, and you live a relatively healthy lifestyle, because that will help increase the mobility of your sperm. I know, right? They're like, oh my God, why is she talking about this? Okay, so going back. All right. So I'm trying to pull. Y'all know I normally have all my information together, but that's all right. We're just gonna keep going. So I posted this. So according to Dr. Natalie Crawford, she says black women have higher rates of infertility. We have fewer infertility treatments, including IVF. But do you understand why we don't participate in the infertility treatments? Number one, the cost of infertility treatments, such as IVF, or even if you look into doing surrogacy. And surrogacy is having your eggs and your husband's sperm implanted into another woman's uterus that would in tune carry your baby for you um, without the ability to do so. We have lower birth rates. We have higher miscarriage rates. We have higher preterm birth rates, have higher fetal death rates, and we have higher maternal death rates. And as I stated, women are 43% higher when it comes to fetal deaths. We rank higher than white women or Hispanic women. So why does that happen? Let's talk about it, y'all. Why does that happen? So yeah, Miss Booster, yes. So I think a lot of reasons we don't discuss infertility in the Black community is because we're ashamed, we're embarrassed, and then we lack the knowledge and the resources. So again, as I stated before, whenever you are trying to conceive, you're in the process. Have these open conversations with your doctor. Let them know: are your periods regular? Um, what can you do to help increase the fertility in your body? Could you change your eating habits? Maybe lose 5 to 10 pounds. A lot of those changes will make it easier for you to conceive a beautiful child. I know, I know. So I do have one more video to share, and then we continue on with the rest of the conversation.
Got a really inspiring story right now from Robin's digital series Thriver Thursday. In the two-part season finale, 2 women are sharing their struggles with infertility.
Yeah, and one of them is Reverend Stacey Edwards Dunn. After her experience, she wanted to encourage African American women to talk about what they've experienced. So she created an organization to support underserved women and couples of color dealing with infertility.
In this country, 7.3 million women struggle with infertility, and Black women and couples are experiencing infertility at 2 times the rate as our Caucasian brothers and sisters. When I was on my journey of infertility, I wanted to be able to talk to other women that looked like me who I felt would understand what I was going through. I want women and men to know that they are not alone. We are here to walk by your side, to listen to you and to support you, and to also provide you the resources that you need to walk this journey. I want to be able to help people live their lives abundantly. When I get a call or get a text from somebody telling me, you know, I'm finally pregnant, I'm filled with so much joy.
So you got some news for me?
I do. I've heard from the doctor today, and my HCG test was positive.
I've seen so many women who have, who hurt so much when they finally become parents, and I'm able to see that joy and experience that joy with them. It is absolutely humbling for us to be able to experience the life of all of these miracle babies that we have seen. It's a beautiful thing.
Everybody, please give it up for Reverend Stacey, who's right here in our audience. We're so thankful for you. Thank you so much for sharing your story and your beautiful family with us. Some other people from your organization are also with us. And if you want to learn more about these amazing women and see the 2-part Thriver Thursday season finale, please head to Robin's Facebook page.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.
So shout out to Dr. Stacey and helping women to become pregnant. So again, drop in the comments. What are other causes? What are also the leading causes of infertility? So my question tonight is, how do you communicate? How do you talk to someone that is struggling to have a baby and you're pregnant? That's a question that I want to know. So drop your answer in the comments. Like, what do you say? How do you have that discussion with someone without making them feel uncomfortable, without making them feel like they're less of a woman because they're unable to conceive? So again, y'all drop in the comments. Let me know what are the leading causes of infertility outside of the ones that I did name. So, uh, how do you cope with the inability to conceive? Again, this all ties in with the mental health. Um, and like I said, this was a conversation that I wanted to bring to the forefront because we don't discuss it enough in regards to infertility. And like I said, it doesn't just affect women, but it affects the men. Men have, can also be infertile. Maybe their sperm is not shaped correctly. Maybe it's not as mobile as it should be to be able to travel up to the egg to fertilize to somehow down the road produce a baby. All right. So Miss Booster says, to be honest, she's not sure. She's here to be educated. And Miss Robin says the same thing. So let me post this back up. Give me 1 second because hold on, y'all. So right there it says in the survey, 50% black women were more likely than white women to say they felt uncomfortable talking to their doctors about fertility. But why is that? Why do we feel so uncomfortable with telling our doctors, hey, I am trying to get pregnant. I've been trying for the last maybe 6 months and I've been unsuccessful. Why is that? Why are we so ashamed and embarrassed? Is it because we feel like we're less than a woman if we're unable to conceive a baby? I think that's a big part of it. Um, I know when I lost my two babies, I did feel like a failure. I was like, I started to question, God, you gave me these two beautiful babies. Why would you take these two away from me? So, like I said, when I went back, so Booster says, as a woman, I'm supposed to conceive. She said, having a child is automatic. So Ms. Robbins says, I think doctors care less, and I don't think we feel confident enough to ask those questions. But what can we do? So when we go to our well woman checkups, and of course, on the questionnaires that you fill out once a year, they ask, have you been pregnant? What issues are you going through? In that moment, that should be your moment to write down what issues you have. So let me ask you ladies this. Would it make a difference if you had a doctor that looked like you versus going to a white doctor? Would that make you feel comfortable if you were going to a doctor that may have looked like you? Or again, if you had that support system where you're able to talk to your girlfriends and say, hey, I'm struggling, me and Rob, or whoever your significant other is, we've been trying to have a baby, but we've been unsuccessful. Would that be Will that make you comfortable if you're able to share with your circle? So Booster says yes, for sure. And I feel the same way because, like I said, I had two miscarriages. So when I had those two miscarriages, I questioned. I was like, well, wait a minute, but why? Again, as I was going into my story, I asked why I had these two beautiful babies. Why would you take two more from me? You gave me two, but then you took two. So as I sat down and I discussed these things with my doctor said, well, Ashley, number one, I'm underweight. Then I was a smoker. I was a drinker. I didn't exercise. My diet was all the way off. So I was always eating processed food, whether it was McDonald's, Burger King, Taco Bell. So I wasn't eating right. And she said that could have been an issue. Then she said it could have been chromosomal abnormalities in regards as to why I lost those babies. Maybe they weren't developing correctly. Or maybe if they would have developed correctly, maybe one of them would have been born with a genetic disorder. Maybe one of them would have been born with like cerebral palsy or something like that, Down syndrome. She said, so never question the work that God does. Maybe that was just not your time for those two babies to come But I did get blessed with my third child, and I'm forever grateful for my rainbow baby. So, when it comes to coping with the inability to conceive, again, that does start to take a toll on your mental. And you do start to feel less than a woman. You feel like all my friends have babies. Why don't I? So then you start to tear yourself down. And that's one of the things you do not want to do when you're trying to conceive a baby, because depression, anxiety, bipolar, all that takes a toll on your health. You know, if your weight is going up and down, if you're not eating like you're supposed to, if you're the way that you're looking to cope is through alcohol or through drugs, through cigarettes, that does take a toll and has an effect on your inability to conceive. On the ability to conceive, my apologies. So drop in the comments any questions that you have. But I do want to say, let me go right here. And I'm going to post this again. I definitely want to break the stigma about Black women and infertility. I want you to know that it's okay. Just, in that moment, it may not be your time to have a baby. And one of the things that I don't want to come across as cold-hearted and callous, because I want to go with you on your journey. I want to understand, and help you process your emotions and the way that you feel in regards of the ability for you to conceive a baby. I also want to say, if we don't talk to each other about fertility, our mental health, our physical health, our financial health, and all those things, then the next generation will be just as confused, sad, and angry. How much truth is that? How much of that rings true? Because to me, they all go hand in hand. Your mental health, your physical health, your emotional health, your spiritual health. I just had this conversation with my girl Christina on her show. She has Women of Empowerment Inc. So y'all go follow her on Instagram. We just had this conversation in regards to health, your wellness, and mental health. It coincides. So when we sit down and we have that tough question in regards to what causes infertility, that's the biggest thing. Stress. Stress, 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 stress. I cannot say it enough. Another leading cause of infertility, polycystic ovarian syndrome, PCOS. Again, women, it's not always you. It could be your husband. It could be your significant other, your boyfriend, whatever. Those are the leading causes of infertility. Like I say, tumors and cysts, fibroids, which are little tumors, little cysts, stress, diabetes, your weight, your diet. That makes a big difference when it comes to the ability to conceive. So Miss Booth says she has a cousin that is having issues conceiving. How do you support her? First thing you have to do, educate yourself. Get all the information, gather all the information and the resources in regards to infertility. Be her shoulder. Don't give her any advice. Let her know. Let me post this for you, Booster. I still have this up. Let me post this for you. So just don't worry about what's on the left side, the right side. I want you to look at what's on the right side. So let me take this off. So what can you say? You want to know how to support her? You let her know, I'm so sorry that you're going through this. Let her know that you're here for her. Let her know that you love her. Let her know you are valid in your feelings. It's okay, like I say, for you to be angry. It's okay for you to be upset. Find ways on how you can ask them, how can I support you? What do you need from me? That's the first thing. Ask them again, how can I support you in this? Do you need me to go with you to your doctor's appointments? What do you need me to do? Tell them you love them. Tell them they're doing a fantastic job. But never tell them that maybe it's just not meant for you to be a mother. Uh, Stop telling them, oh, it's common, because they don't want to hear that. We don't want to. We don't want to be told that we're like everybody else. Oh well, so and so can't have babies either. That, to me, that sounds so callous. It's almost like no feelings. You get what I'm saying? So you want to be as supportive as you can. You want to understand their feelings and allow them to be angry, allow them to be sad, allow them to be mad. You know. So Booster says our culture doesn't make it any better. Absolutely not. It does not make it any better. So Ms. Robin says she agrees. She said, I don't think we have the conversation about fertility. No, we don't. But in regards to mental health, it all ties in together. Because anytime, like I say, when it comes to, let me pull this list back up. Let me pull my list back up. So I pulled up a list in regards of what causes infertility. So I was saying stress. So mental illness. Anybody that's going through depression, anxiety, that does take a toll. Like we stated tonight, it takes a toll on your health. So in tune, that may affect your ability to conceive a baby because you're stressing. Because your weight is not consistent. You know, your weight is up and down. Um, that and then a hormonal imbalance could be a cause. I know I've heard that that could be regulated with birth control, but some people don't like taking birth control. But again, these are discussions that you have to sit down and you have to talk about with your doctor. You have to be open with your doctor. Your doctor cannot help you if you're not open. So Ms. Robin says she miscarried and no one had the conversation with me. I'm afraid that I might not be able to cook. I might not be able to have kids. So Ms. Robin, when you had your miscarriage, because I know we talked about this last week on Tuesday night's episode, have you been back to the doctor to check to make sure your eggs that you're ovulating every month, that your fallopian tubes are open, that they're not blocked? Those are things that you have to do. Since don't automatically assume that you can't have babies. Go ask those questions. Get with your gynecologist and say, hey, I had a miscarriage XYZ years ago. I'm afraid that I may not be able to have children. And they will provide you with the resources in regards to the testing. Um, I know one of the things that they do utilize to see if your fallopian tubes are open is the dye test. I'm sorry, the blue dye test is what it's called. Where they inject your tubes with a blue dye to make sure that they're open. And then also, Miss Robin, you want to make sure that your husband or your significant other, his sperm count. So you want to do it at the same time. You want to make sure that you're eating right, that you're exercising, that you have no stress, and same with your husband. No stress. You want to make sure no alcohol, no drugs, cigarettes, anything that could affect the inability for the sperm to be immobile, which means the sperm is not able to maneuver through to get to the egg. So you definitely want to check into that. And like I say, it's not just us women. Men can be infertile too. So we're not just talking to the women tonight. We are talking to the men as well. Right. Insensitive. That's the word I was looking for. Yes, that was absolutely the word. Hey, Will, thank you for tuning in, big brother. Y'all don't forget Y'all tap in with my brother, Big Brother Will, because he has two amazing podcasts that come on Sunday. The ADHD Hour podcast, as well as the Black Male podcast. You can follow him on Facebook, follow him on YouTube. When I tell you, he has some amazing content, especially the Black Male podcast. Oh my gosh, I love it. And he is every Sunday, 3 p.m. Central Time and 6 p.m. Central Time. Again, go follow Big Brother Will, ADHD Hour podcast, as well as the Black Mailed, MALD podcast. And you're more than welcome, Boost. You're more than welcome. You know, as I said, we have to be selective with the things we say to people because at times, yes, we may come across as we're caring and endearing, but like I say, it's not what you say, sometimes it's how you say it. So you have to be careful with that, especially, you know, like I say, we as women, when we, oh, so he changed it. So the Black Male podcast is now Tuesday at 8 p.m. And he said he might change it to 7 to catch me. Oh, so I'm gonna be jumping back and forth, but don't worry, you know I'm gonna be tuned in. You know, because I love everything you guys talk about on the Black Male podcast. I absolutely adore it. You guys are too funny, but real. And I love to get unbiased conversations in regards to learning about the black man, because y'all know I love y'all. Oh, you black men are wonderful. Okay, Eric had a problem with scheduling. Trust me, definitely understand. Definitely understand. Definitely understand. So we'll work it out so that way, because I definitely want to make sure that I have to watch an episode all the way to the end. I have to watch it all the way to the end. I can't just jump in and then I got to jump off. Nope. So I may change mine to Wednesdays and Fridays so that way I'm able to catch your show too. So we're gonna work it out. You're welcome, brother. Absolutely. So Miss Robin, absolutely great info. Um, But you want to do that. You, like I say, when we go to our well woman checkups once a year, you know, we can tell them if we're having issues, you know, if our period is too heavy. We never have issues with that. So let's normalize talking to our OBGYNs and saying, hey, I had a miscarriage or I had an abortion or whatever the situation, I had a stillbirth. I want to make sure that I am healthy enough to try again to conceive a baby, because you don't want to run into the same problems if you don't know if there's an issue. Because again, it's not always us women, it's men as well. So, pulling up some more information. So it says, generally speaking, infertility in men is related to the following issues. Does he have an effective production of sperm? Is he producing enough sperm? That's first and foremost. The sperm count, which is the number of sperm. Does he have just 2 sperm or a million? Now I know it's not a million, but I'm just making it up. The shape of the sperm, the movement of the sperm, which includes both the wiggling motion of the sperm themselves and the transport of the sperm through the tubes of the male reproductive system. So, although he's ejaculating, are they moving the way they're supposed to? Are they mobile? Are they mobile enough to move out of his tubes and into yours to fertilize your egg? So women, stop beating yourself up. Men, I need y'all to go get your checkups as well, especially again if you're trying to conceive. Definitely that's what I want you to do, because we need some more black babies. Definitely need to know. We definitely need some more black babies. So again, going back to how do you cope with the inability to conceive? So, no, let me jump back one more time. So going back to the leading causes of infertility, I did pull up some more things. So it's a risk factors, excuse me, this is regards to the men. The risk factors associated with infertility in men include, but they are not limited to, older age. Age plays a factor. And I know they say with women, the older you are, the less eggs that you're ovulating. And I know they say men can have babies all the way up until they produce sperm all the way, can have conceive until all the way up until they die. Um, but their older age. Um, Cigarettes, alcohol, your weight. Weight. Are you overweight or obese? I'm talking to the men now. Ladies, I always talk to you, but I'm talking to the men right now. I'm going to get back to us, so don't worry. And with men, exposure to toxins such as pesticides, herbicides, and heavy metals. So if you have your significant other works in a refinery, uh, things of that nature where they're exposed to toxic chemicals, that has an effect on their ability for the sperm to come out. Weed, right? The marijuana, and I've heard that too, and that goes for men and women. So if you are an avid weed smoker, marijuana does lower your sperm count. Fellas, come on now. It's okay to puff every once in a while, but chill out on it, especially if you're trying to have a baby. Because that does affect, your sperm is high and don't know where it's going and they die. So chill out, fellas. Lay low. Ladies too. When it comes to your diet, ladies, be mindful of what you're eating. Be mindful of all the drinking, the smoking, the partying, all of that there. Tone it down a little bit, especially if you're in the process of trying to conceive and have a baby. So another thing in regards to men, and again, I know we don't talk about this, medical conditions. What medical conditions in regards to men will prohibit the ability that causes infertility? So looking at my list, retrograde ejaculation. We're going to talk about that one. So it says, what is retrograde ejaculation? So in males, urine and ejaculate both pass through the urethra. There's a muscle or a sphincter near the neck of the bladder that helps to hold in urine until you're ready to urinate. So it says in the retrograde ejaculation, this muscle fails to contract. So it says because it stays relaxed, the ejaculate ends up in your bladder. The result is what is called a dry orgasm. Ooh. Woo. That's a lot, y'all. And it says, despite the lack of ejaculate, it feels like a normal orgasm and doesn't usually affect sexual pleasure. It's not a disease or a serious threat to your health. So, fellas, y'all need to go get checked too. Just like we women need to, you fellas need to go get checked too. Then it says, I don't know how to say the word, but I will tell you, the swelling of the veins around the testicles. Ooh, fellas. Just like us women go through it, your men go through it too. So, varicocele, I believe is how you say the word. It says the scrotum is a skin-covered sac that holds your testicles. It's similar to varicose veins. So what it does, it causes the testicles to shrink. So you go from having these big balls to little peanuts. That's what it is. And when that happens, it decreases your sperm production. That's what happens. So Will says diabetes, high blood pressure, right. Weight, and what you eat, your lifestyle. Also, in men, testicles that haven't descended into the scrotum. I know that's common. I've seen it. And I know some men who've had to have surgery to drop the testicles inside the ball sack. I'm going to call it that. That's the ghetto term. So I'm going to call it that. Also, a hormonal imbalance in men, such as a low testosterone production. So maybe your body's not producing enough testosterone. And again, fellas, that doesn't make you less of a man. There are options out there. There are treatments out there that will help treat infertility. But again, they're very, very, very expensive. Very expensive. So Boo says keep it coming. Right. So Boo's, like I say, we always talk in regards to women issues, but we never talk in regards to men issues. So those are just some of the things that I pulled up in regards that are the leading causes of infertility in men. So again, when it comes to women, ovulation. Are we ovulating every month? So it's always good to get the BST, which is a basal system. Check your temperature, you know, at the right time that you know you're ovulating, because I know your temperature in your body increases when you're ovulating, and it decreases once if you don't get pregnant and you start your cycle. Um, Again, a lot of the things are the same things that increase the infertility in men, also are the same with women. Um, Having sexually transmitted diseases, let me say this, untreated sexually transmitted diseases will cause you to become infertile. If not infertile, you will become sterile if you leave it untreated. So if you get chlamydia, gonorrhea, and it's left untreated, you do run the risk of possible infertility or sterility, which sterile means you cannot conceive babies at all. With women, oh, come on, ladies, let's talk about this. Fibroids. You have fibroids. Polycystic ovary syndrome, or hormonal imbalance. I suffer from PCOS, and I didn't know what it was because I started getting these little hairs on my face. And my doctor was like, "Yeah, that's PCOS." So what PCOS is, for the ones that don't know, and again getting educated, PCOS is women that produce higher than normal amounts of male hormones. That's what polycystic ovary syndrome is. Your body is producing more testosterone and less estrogen. Hence, that's where the hair comes from. You get, I can never say the word, hirsutism, which means that's why you see the women with the facial hair. You see the hair around your nipples. You just have an overabundance of hair. So that's what polycystic ovary syndrome is. Your body produces more testosterone than it does estrogen. So that causes, infertility. Pelvic inflammatory disease, endometriosis, which is the lining of the uterus is very thick. I know women that have had DNCs to try to thin out the lining of the uterus because it's so thick. And with the lining of the uterus being so thick, the sperm is unable to maneuver through the thickness to reach your egg. The uterine fibroids, they could be malignant or non-malignant cysts that are on the ovaries, tumors. And then you have premature ovarian failure, which is something I have never heard of. Um, Again, I guess that's considered early menopause. So your body starts to produce less estrogen and progesterone, which are the main hormones in regards to the female reproduction. So when those start to drop, that does decrease your chances of getting pregnant. So these are the things that we need to start normalizing in the community, is when we go to our doctors, be open and honest with your doctors and let them know, hey, I'm having issues. I've been trying to get pregnant for the last year. I've been trying to get pregnant for the last 6 months. Inform your doctors, because your doctors can absolutely point you in the right direction in regards to getting your treatment to where you're able to conceive. And make sure that your spouse, significant other, husband is on board in regards to that. Because again, ladies, it may not always be you. So I want you to stop beating yourself up. That's absolutely one of the things that I want you to do. So these are some of the things that we can learn how to cope with the inability to conceive. Let me post my list one more time. Again, pay attention to what's on the right. So if someone comes to you and they're saying, I've been struggling to get pregnant, please let them know that you're there for them. Please show an abundance of support. Be their shoulder. Don't try to offer any type of therapy because you're not a licensed counselor, therapist, whatever, but be sympathetic. Let them know I understand. It's okay for you to feel the way that you do. You're not wrong. You're absolutely great in regards of why you're feeling the way that you do, and you're entitled to that. Don't ever make the conversation about you. Let the conversation be about the person. Because sometimes they're not calling you to get advice, they just want to vent. They just want to talk about what they have going on. So let's learn to say that. Tell them that you love them. Let them know. So Ms. Robbins says black people are afraid to be honest with their doctors. But why though? So, Ms. Robbins, so when we're doing those questionnaires and they ask any other issues, okay, so now you put a list and say, hey, I have heavy menstrual cycles. I'm unable to fall asleep, or, I'm able to fall asleep, but I'm unable to stay asleep. Why can't we be open and honest with our doctors? Is it because the doctors lack the knowledge? Could it be because when we've tried to be open with our doctors, they've shut us down? In our minds, do we have a sense of thought where we feel like they're not going to understand? So Boo says she thinks it's because the other side has failed us in the past. Let's talk about that. So I know on a video that I shared, I know it talked about the lack of resources in regards to that. Let me see if I can pull that video back up, because it does really tie into infertility, and this could be the reason that we're not open and honest with our doctors. Let me see if I can find that video. Let me see if I can find it. Give me 1 second. But I believe. So let's go here. I want to say this is the video. So I want to play this quick video for you, and I want to show you how it correlates with what we're talking about tonight, because I really honestly believe healthcare is not always readily available. So while I'm waiting on that to upload, so Robin says yes, they don't trust them. And so Boo says we don't know our rights, or maybe some doctors are stuck on what they read rather than who is in front of them and their experiences. That last line, Boost, is absolutely the truth. So in that moment, would it be safe to say that maybe we should try to find another doctor that's a little more relatable, or a doctor that is willing to understand and listen to us as we're talking, and not just shun us off as they don't want to hear it? Talk to me. Y'all let me know. So I want to say this is the video. No, this one may not be it. Hold on. Let me go back. I'm really trying to find that video, because that might be the one. Okay, here it is. Okay, let me upload this one. Because I want to show how it correlates in regards to why we don't trust these doctors. I wanna talk on that. I wanna elaborate a little bit more. Why can't we be open with our doctors when we go in there and say, hey, this is what's going on. And to just, while I'm waiting on this video, just to kind of share a little bit, I was uncomfortable at first when I go to the doctor, when I go for my well woman checkup, and of course, they ask, what is your period like? Is it 28 days? Does it come every 30 days? Does it come every 32 days? And then when they get to that imperative question, are you experiencing any other issues? So I have very heavy cycles. So like the first couple of days of my period, I bleed very heavy. So I'm wearing pads. I don't know what happened. Oh, there we go. Oh, wait a minute. Something happened. Hold on. Oh, all right. There we go. Technology just never does what you need it to do. It never does what you need it to do. So, let me go. All right. So, Boo says, for sure, she's speaking from experience. She said to be transparent is hard enough. So, you have to do it until we meet someone that is willing to walk hand in hand with us. Right. That's like that's like, because I want to jump back into mental health for just a moment. That's like when you go to look for a therapist. You get what I'm saying? You have to find the right one that's willing to help you unpack your suitcase and not just be there to get paid. So I'm right there with you. So Ms. Robbins says insurance limits us. She said, depending on the insurance you have, you can get a shitty group of doctors that we have access to. Should we be shopping for doctors? You hit the nail on the head. If I'm not Ms. Robin, excuse me, this video that I'm about to play is absolutely what you just said. Let me go. Here we go.
We've been talking a little bit about losing a child, a miscarriage, and we want to find out why it's happening, and that's the question that we get asked all the time. Mm-hmm. Why is it happening? What's going on?
So it can be really divided into three things. Mm-hmm. One is unexplained. We have no idea why it's happening. Mm-hmm. Most of the time, it's something that is a genetic thing that happens spontaneously. So, when eggs and sperm come together and they mix and they have to divide into cells evenly, those chromosomes need to pair up in pairs.
Okay.
And when the chromosomes don't line up the right way, we call that aneuploidy. And when that happens, the pregnancy doesn't develop the normal way, mm-hmm. and women will miscarry.
Right.
Sometimes it is due to maternal factors, so something's in the female uterus, the shape of the uterus. Sometimes people have what's called a Mullerian anomaly, which is a big word to say when the uterus is forming embryologically, it doesn't form in the right shape. Mm-hmm. And then when a pregnancy tries to implant in the unusually formed uterus, it miscarries. Mm-hmm. So that would be a maternal factor. Yeah. Sometimes when moms have other diseases like diabetes, they're at higher risk of miscarriage when their sugars are not as well controlled.
Right.
One we've talked about before, polycystic ovarian syndrome, that would be another maternal factor, so a woman factor. And then in the fetus, if the fetus is developing abnormally congenitally, so just the way that it's folding and dividing, it doesn't happen normally, mm-hmm. then that would also end in miscarriage. But the number one reason is genetics that are sporadic, no control. There's nothing you could do to prevent it, mm-hmm. Until the day comes where doctors will be able to program the way genes combine to make a baby. There will be no way that we can change the genetic abnormalities that have happened and that result in miscarriage. So that really brings me to the big point that I need to drive home in this conversation that I have in my office often, almost mm-hmm. daily, is there's nothing that you could have done to prevent this from happening. And women need to we are crazy guilt people. I don't know why,
yeah.
But pregnancy, it doesn't only rely on the women. The pregnancy also relies on the men, who relies on the genetics, the combination. A lot of this is random. Mm-hmm. And much as we feel the devastation, and I get it, the wanting of a pregnancy, the desire for pregnancy, and sometimes it's guilt not only from yourself, but from family.
Which is brutal.
Yeah. Yeah.
Like, it wasn't the fact that you were working out, it wasn't the jog you took, it wasn't that, you know, you're working too long hours.
You didn't sleep, you do shift work.
You didn't sleep, you're not eating well enough. This is like, it's completely beyond you. And I'm just going to leave you with Christina, another viewer, who said, the stinger is at every doctor's appointment afterwards when they ask you, how many pregnancies have you had, followed by how many living children. It's something you've got to live with forever. And a lot of people think, you know, just because the miscarriage is done and you've had more kids, you've forgotten it, but you don't ever forget.
No, and doctors can be insensitive sometimes. I mean, I am a women's health doctor, I'm a fertility specialist, so, you know, we have questionnaires, I let people fill it out, and I'll write it in from the questionnaire. I don't like to
make people repeat it again and again.
Because it's traumatic. Yeah. And I think that some of my patients, not everyone, but you know, we talk about mental health and things that can be triggering. And having to talk about it every single time you have a doctor's appointment can also be triggering.
Right.
And this can actually put people into depression. So it's also important to know that you have healthcare providers, and there are mental health care providers that are there to support women, and we have that in our office to support women, not just from the medical perspective. Yes, you're bleeding. I'll make sure you get the medications and make sure your uterus is clear. But also, are you okay?
Yeah.
Because this is a lot. It's a lot to deal with, and sometimes even the partners don't know how to handle it. So patients and individuals need to know we need to talk about this. We need to know that there are supports and there are people who can help us through this, and you're not alone.
Yeah, you're not alone.
You're not alone, and you didn't do it to yourself.
Find the resources and keep the conversation going on Twitter. So at CityLineCA, if you have any questions for us or other topics you want us to cover, we will cover them.
So there you go. Exactly what we just said. Hey sis, good to see you, honey. So there you go, Robin. And there you go, Boost. She said it perfectly. You know, like you say, to be transparent is hard. And again, having to repeat that over and over again. I'm struggling. I still have yet to get pregnant. Right. So again, that goes back to, Robin, what we were talking about today in regards to mental health, the health and the wellness. It all goes together. It coincides. So drop in the comments. I want to know, how would you cope with the inability to conceive? I want to know. And moving on. So while you're dropping in the comments, let's move on to the next one. Your various options and support for infertile men and women. There's so many support groups. Family, you know, your close circle of friends. What can we do? How can we continue to support someone who's struggling to conceive? What are the various options and support for infertile men and women? So, y'all know I'm pulling up information. So, in regards to men, men should plan to see a doctor after 1 year of trying to conceive, or if any of the following apply. Erectile dysfunction. Are you struggling to get a hard on? You know, men, problems with ejaculation. These are things that when you go to your doctor, I'm talking to the men now. These are things, men, you need to address with your doctor. Are you having problems with ejaculation? What is your sex drive? Do you have a high sex drive or a low sex drive? Do you have pain or swelling in the genital area? Or have you undergone a previous surgery in the genital area? So these are things that men, you need to start discussing when you go to your doctor's appointments. You know, when they ask, when you go for your physical, let your doctor know, hey, I'm having a difficult time trying to get an erection. Men, y'all need to learn to be open with your doctors too and express to your doctors. You know, one of the things that they will do is they will ask you your medical history. Do you smoke? Do you drink? What is your diet like? Do you exercise? You know, what kind of job do you have? They want to know these things. Because like I say, stress is a major factor in infertility. So your doctor will also, for men, I'm talking to the men, ladies, I'm coming back to us in just a moment. But right now I want to talk to the men because men are often left out of this equation. And again, when it comes to these particular topics, it's always the women, the women, the women, the women, the women. But men too. So tonight, right now, I'm just talking to the men, and of course, y'all know I'm coming back to my ladies. So don't worry. Um, so what your doctor will do, fellas, he'll take a semen analysis. So which means you'll go in a little room and he'll give you the little cup with the little magazine, you know, your jack off in the little cup and they test your sperm. Um, the test may include hormone testing, genital ultrasound, and then genetic testing. As the doctor stated in the video I just played, genetics. So for women, I'm talking to my ladies. So Ms. Robbins says, I would figure out what my options are. But you could also ask your doctor, what are your options? What are the treatments out there that treat infertility? Again, you have IVF. You have IVF, which is the in vitro fertilization where they remove the eggs from your uterus. They remove the man's sperm. No, you start taking the shots. I'm sorry. To get your body ready. Um, I just lost my train of thought. I was about to say artificial insemination. My apologies. Is where they take the egg from you and the sperm and they put it in a little dish and they till it fertilizes and then they inject it back into your uterus and hope that it forms into a viable pregnancy inside your uterus and you don't end up with an ectopic pregnancy or possibly a miscarriage. So one of the things that they'll do for us women when we go for our exam, a pelvic exam. You know how they do when we get out, do our well woman checkups. You know, we do the pap smear. Um, they swab, you know, and make sure that, you know, there's no cancer cells. Um, they make sure there's no fibroids. They make sure there's no endometriosis or pelvic inflammatory disease. Women, one of the things that we are not open and honest about when it comes to our doctor's appointments is if we've had a sexually transmitted disease. Because again, as I stated, a sexually transmitted disease that goes untreated can leave you infertile and possibly sterile. Infertility and sterility is different. Infertility means, you know, you haven't been able to conceive within a year. Sterility or sterile means you can't have babies at all. And that affects men and women. Um, so what they do is for us women, they do an ultrasound to check out the ovaries and the uterus to make sure, again, you have no tumors, whether it's cysts, fibroids. I know I had not HPV. Um, they saw the cancer, the precancerous cells in my cervix. So I had to cryo freeze and I was good after that and I was able to go ahead and have my babies. Um, but they will also do the follicle stimulating hormone test, which is the test, is the ovarian reserve testing, which uses, these are the tests, um, which is it's an X-ray used to evaluate the fallopian tubes in the uterus. That's the one I believe where they inject with the blue dye, and the dye runs through to make sure that your tubes are open, so that way the sperm are able to flow through and be able to reach your egg. Laparoscopy, which uses a camera to examine the internal organs. So of course, ladies, you know how that goes. Like you're doing a pap smear, but this time they're going with a camera to look and see if they're, you know, if they see any abnormalities in your uterus. And then you have the ovarian reserve testing, which is a test used to determine a woman's potential for conceiving, and that is called the follicle stimulating hormone test. So we go into the treatments, which again, the various options and support for infertile men and women. So for men, male infertility can be treated in a variety of ways. Treatment can include surgery, medication, or assisted reproductive technology. Because a man may have an obstruction in his urethra, is what it's called, which prevents the sperm from coming out. So although you think he is ejaculating, is a sperm that's coming out of it, or as I call it, is it just water? Don't judge me, y'all. Don't judge me. So there we go. Medications. They can give medications for erectile dysfunction. And then when it comes to the ART, which is the assisted reproductive technology, that's the in vitro fertilization. And then you have the intracytoplasmic sperm injection. So which means the ART treatments can be received from ejaculate extraction from the testicles or from a sperm donor. And I know some people don't like to talk about that, but hey, like I say, doesn't make you less of a man. It doesn't make you less of a woman. Absolutely does not. All right. So for women, again with us, correcting an abnormally shaped uterus. So your uterus, if it's not shaped correctly, could also hinder your ability to conceive. I think it's called a tilted. I'm gonna tell y'all, a tilted, or a splighted ovum. A blighted ovum is what it's called. In regards to your uterus not being shaped correctly. Fallopian tubes may be blocked. Again, they do the dye. They run through to make sure your tubes are open. And then if you have fibroids, whether they're just little cysts or whether they're fibroids, getting those removed, because if they are on your fallopian tubes, they will block ways for the sperm to get through. So sometimes it works, sometimes it doesn't. And doctors do tell you 50-50 chance or a 60% chance that you may or may not be able to conceive. So before you jump into these options, you definitely want to get educated, and you definitely want to be prepared mentally, physically, and emotionally for this, because I know it is a long journey. And I know, we struggle with patience and wanting to get everything, and we want everything done right then. But again, you have to be mentally, physically, emotionally, and spiritually prepared to go on this to embark on this journey. Oh, beautiful, beautiful, beautiful. So before I roll into my final thoughts, I just have one more video. In regards to what you were saying, Miss Robin, in regards to insurance. So bear with me, I'm gonna play this brief video, and then we're gonna roll into the final thoughts for tonight, and then we'll discuss what we're gonna be talking about on Thursday nights. So here we go.
As we dive into this topic of bias, we wanted to look at bias within healthcare. We found a startling statistic, too. Black women are 2 to 3 times more likely to die during childbirth than white women. Looking at the numbers here locally in Kansas, of those women who die due to pregnancy-related causes, 70 per 100,000 are black. Compare that to white women, who account for 22 per 100,000. In Missouri, the numbers are even higher. 92 for every 100,000 deaths involve black women versus 22 for white women. The increased rate is similar for infant mortality. Black babies, 2 to 3 times more likely to die at birth. While there are a number of factors that play into these statistics, some experts and advocates point to bias in healthcare as being a contributing one. And it's not just African Americans. Latina and Indigenous women are disproportionately affected too. 41 Action News anchor Caitlin Canute has stories from 2 women who say bias left their lives forever changed.
Although it's been 8 years, Sapphire Garcia-Lease can still remember the excitement surrounding the birth of her second daughter, Ella.
Everything had gone perfectly fine with my pregnancy. And then I got to 38 and a half weeks, and I noticed that she wasn't moving as much.
Garcia-Lease says she visited her doctor and shared her concerns, but was told that was normal. So, despite a nagging suspicion, she returned home, only to seek out a second opinion at the hospital 2 days later.
They did a sonogram, and they couldn't find a heartbeat. She had passed away in utero. And it turns out that she had her cord wrapped several times around her neck and her blood supply had cut off.
Heartbroken and devastated, she delivered Ella, knowing there would be no first breath, no first cry. Holding her stillborn daughter, she says she couldn't help but wonder if her race prompted the doctor to disregard her concerns.
And if they had caught that in time when she was still moving some, then I think that she probably could have been saved.
Research shows women of color are more likely to experience bias in healthcare. Some experts say this dates back to the 1800s when James Sims, often referred to as the father of OBGYN, performed experimental surgeries on enslaved women without anesthesia.
So historically, what that has done is that has created a bias that black women can take more pain, that they're stronger.
As an assistant professor with the University of Kansas School of Medicine, Dr. Charla Smith presents this very topic to local medical providers.
So there's an assumption that if you're black, that you're from a particular community, you're uneducated, you don't have health insurance, you don't have a good job, and so you don't have the knowledge to actually know how to take care of yourself.
For Kansas City mom Izula Maximilian, she's convinced this bias prevented hospital staff from taking her seriously when she went to the emergency room, suspecting her intense pain was the result of another ectopic pregnancy.
When I spoke to the admissions officer, I told him that I was pregnant, that I've had ectopic pregnancies in the past, and that I'm having one right now. And he told me to go wait and sit down.
According to the Mayo Clinic, ectopic pregnancies, where a fertilized egg implants in the fallopian tube, can cause life-threatening bleeding. But Maximilian says that day, besides giving her a drug test, no diagnostic tests were done for 4 to 5 hours as she floated in and out of consciousness until finally blood work came back showing she had sepsis.
And that now they wanted to do an ultrasound and figure out what was going on. And when they did the ultrasound, they were able to confirm that there was a burst in my fallopian tube.
She'd lost half her blood supply due to internal bleeding and was rushed into surgery, but not before she first said goodbye to her young son.
I do remember him, saying that he loved me and me telling him that I loved him and being concerned it was going to be the last time that I saw him.
After the surgery, she recalls opening her eyes with a sense of purpose, vowing to share her story so no other woman of color experiences the trauma she endured. These are just some of the stories being shared with doctors here in Missouri and Kansas, and they've caught the attention of the American College of Obstetricians and Gynecologists, or ACOG.
So what I would say to these folks who are sharing their stories is that I believe you, and that ACOG believes that this is a problem within our own practice and the larger system of healthcare and wellness.
Dr. Colleen McNicholas adds while education and accountability are a necessary step, there's more that needs to be done on a broader level.
Simple things, expanding Medicaid, having access to preventative care, looking at what access in rural communities, for example, looks like.
That's where the Uzazi Village, a nonprofit in Kansas City, helps fill the gaps.
What we're trying to do is reverse those health outcome trends and help our community families have healthier pregnancies and healthier babies.
Uzazi Village works directly with women and families, offering them prenatal and postpartum education, resources, and support, including providing expectant moms with doulas.
A doula is a professional labor support person, so a professional labor coach, except that our doulas are also trained to work with women during pregnancy and in their postpartum periods.
For Garcia Lise, it's a service she knows well. She became a doula in Wichita after losing Ella. Also, she could better advocate for women of color and their babies.
I've seen clear-cut cases where the work I do as a doula has paid off with a better outcome for the mom or the baby.
It's a fight to help others that keeps her motivated and helps keep Ella's memory alive. Caitlin Canute, 41 Action News.
All right. So Ms. Robin, yeah, absolutely was dead on. In the video it did state, insurance, race, very biased. Whew. Boy. We gotta do better, y'all. We gotta do better as a people. We have to be open when it comes to these doctors. Okay. All right. So y'all already know we have now reached the end of another episode of Black Girl Interrupted. Oh, I feel like something was crawling on me, y'all. And I roll into my final thoughts. So tonight I discussed infertility and the Black woman. I want to be somebody's mother. Why don't we talk about this? Why do we feel uncomfortable when we go to our doctor's appointments? Why is it so difficult to express to the doctors when we have to fill out those forms and they say, what other problems are you experiencing? I know it was my braid. My braid was caught in the shirt and it felt like something was crawling on me. That's what it was. Oh no bugs. Girl, it was the braids. And right, absolutely, healthcare does need reform. You know, as I stated, Black women are 43% higher when it comes to infant mortality. When it comes to maternal mortality, you have more Black women that are dying in childbirth. You have more Black women whose babies are dying in childbirth. We rank high when it comes to stillbirths. We rank high when it comes to miscarriages. We are starting to rank higher now when it comes to infertility. But again, we have to find a doctor that is comfortable with us, that will listen to us, regardless of what type of insurance you have. Because I've experienced that. You know, when I had Medicaid, I had to search through doctors before I found the best one. And I still go to her to this day. And here it is. My baby is 11. So I still go to her to this day. The same doctor that delivered my baby girl, I still go see her every year. And I've been very open with her. When I go and I sit and I talk to her, I told her, you know, I expressed to her, you know, that I possibly wanted to have another baby, even though my tubes are tied. And we had that conversation. Yeah, I was nervous, but I said, you know what? Who else can I tell this to? Who else could give me the options in regards of what I want to do? Because I don't know. Can I even go through a tubal reversal? So I had to ask her. So Ms. Robbins says there needs to we need to have more doctor-patient relationships. Doctors these days don't care. They want to get you in and get you out. Right. And I think and I hate to really use this analogy, but when it's almost like when you're searching for a doctor, it's like buying a car. You know, and when it comes to us buying a car, you want to make sure it's the right color. Do you want leather or do you want cloth interior? Do you want black interior? Do you want light interior? You know, and I think it's sad that it has to come to that when it comes to, healthcare. When it goes to trying to find a doctor, I've got to search to find the perfect one. Why can't I just get it right the first time? But I mean, and then, you know, like you stated, Ms. Robin, your insurance. Certain doctors take certain insurances, and you know, if you go out of network, you know, you try to find a doctor that's in network, and then maybe the doctor that you want or the doctor that you've heard great things about may not be in network. So now you have to figure out, okay, I've heard great things about this doctor, but this doctor's out of network. Do I want to pay the out of network cost when it comes for me going to see this doctor? It's like scales, you know, like a seesaw. It's like, okay, I like this doctor. He or she's a phenomenal doctor, but this doctor's not in network. Or when you think you found the right doctor, that doctor turns out to be bullshit. And then you're back to square one, trying to find the right doctor that can help you, and really shows that they care, that they're empathetic with you, that they actually are listening to you, that they are actually paying attention to you. I will say I'm absolutely blessed. I have a great primary care physician and I have a great gynecologist, you know, that really take my concerns and they are actually listening to me. You know, when I went to my primary care physician, you know, back in October, I was open and honest with him. When I told him, Doc, you know, I know you told me to stop smoking, but I fell off the wagon again, but I'm ready to get back on. I'm ready to stop smoking. So I like the fact that he got on me and said, hey, Ashley, come on now. You are a black woman. You're overweight. You know high blood pressure and heart issues runs on both sides of your family. So I'm blessed to have found a great doctor like him. I'm blessed to have found a great gynecologist, obstetrician, who again I've been going to see her for the last 11 years, almost 12 years. So it's all about trying to find, it's all about finding, not trying, but it's all about finding the right person for you. The right person that takes the time and listens to all your issues and addresses your concerns instead of just saying, okay, well, guess what? Just do a hysterectomy. Because I had a doctor when I lived in another state. I complained about the heavy cycles and the clots. And her first thing was, well, you should do a hysterectomy. Not, well, maybe go get a second opinion or maybe try. It was no options. Her only option was a hysterectomy. And when she said hysterectomy, I never went back to the lady. Because you didn't give me options. That was the first thing you told me. That was the first thing that came out of your mouth. Hey, let's just do a hysterectomy. Not, well, let's try to, let's try birth control. Let's try this. Let's try that. It was, let's just do a hysterectomy. So, Robin, I feel you when you say you run across some shitty doctors. You run across some doctors that just don't care, that are only in it for the money. So sad. So, going down to my final thoughts for tonight, infertility. How do you deal with that? How do you cope with it? How do you support someone who's going through it? Be their support system. Tell them you love them. Let them know that it's okay for them to feel the way that they feel. They're entitled to that. Mind the things that you say. Sometimes it's not what you say, but how you say it. That's what it's about. Fellas, go get your checkups. Go get your regular physicals. Because ladies, I want you to know it's not always the ladies, it's the men who have the infertility issues. It may not always be you, it's the men. So men, I need you to go get your regular checkups. I need you to go get those yearly physicals. I need you to get your prostates checked, when it's time. I need your overall health to be A1. So if you're in the process of trying to conceive a baby, weigh your pros against your cons. Get your eating habits, develop better eating habits, exercise. If you drink, limit your alcohol intake. If you smoke, try to cut back smoking. If not, stop smoking completely. It's all up to you to make those lifestyle changes in order to be able to conceive. Don't be afraid. And when you fill out those questionnaires, be open and honest with your doctor because your doctor doesn't know unless you tell them. So you have to tell your doctor, hey, this is what I'm going through, this is what I'm experiencing. And those are my final thoughts on infertility. So y'all already know I am live every Tuesday, every Thursday night, 8 p.m. Central Time. Black Girl Interrupted is on Facebook. I'm on Instagram. I'm on Twitter. I'm on YouTube. And I'm available on all the streaming platforms. I am. So hit that like button. Hit that subscribe button. Hit that share button. Grab a friend. Make sure you hit the notification bell on Facebook so you don't miss another live episode. Don't forget, this Thursday night, tune in with your girl. Again, I'm continuing the conversation in regards to mothers. I'm talking about ectopic pregnancy. What is it? Why does it happen? Can it be prevented? You won't know unless you tune in with your girl on Thursday night, 8 p.m. Central Time. Y'all got to talk about it. Again, y'all know we're going to continue to have these uncomfortable conversations because they need to be brought to the forefront. We need to sit down and we need to have these conversations amongst each other, men and women. We create, boundaries. We set the bar. We have standards. So come on in with your girl. Let's continue to have these uncomfortable conversations. Let's continue addressing the interruptions that we go through in life. So again, y'all, don't forget Thursday night, 8 p.m. Central Time, 9 p.m. Eastern Time. I am going to be talking about infertility. Ectopic pregnancy. My apologies. We talked about infertility tonight. But Thursday night, y'all already know. Catch me on Facebook. Catch me on YouTube. On YouTube, subscribe. Facebook, subscribe. Hit the notification bell so you don't miss another live video. But on that note, I do want to end by saying this. Again, y'all do know it is Mental Health Awareness Month. So I want to continue to shine the light on mental illness. If you or someone you know is experiencing any type of suicidal thoughts, if you are in a crisis, please call 911 or please call 1-800-273-8255. Again, Suicide Prevention Lifeline, please call the number 1-800-273-8255. If you feel like you can't talk to anybody, there is a text number. Text TALK to 741-741 to text with a trained crisis counselor from the crisis text line. It is 100% free. It is available 24/7. So again, if you can't talk to anybody, text the word TALK to 741-741. Call the National Suicide Prevention Lifeline. Again, that number is 1-800-273-8255. You know anybody. Suicidal thoughts. Pay attention to the signs, y'all. Pay attention to what your people are posting on social media. Check in with your strong friends because your strong friends aren't always strong. They need a little love too. So check on your friends. It only takes 30 seconds out of your day to send a text. 30 seconds out of your day, pick up the phone. 30 seconds out of your day, send a text. Let's normalize that. Let's normalize and checking in on our strong friends. Let's normalize and checking on one another. If you're in a crisis, 1-855-274-7471. That is the statewide crisis line. It helps if you're in a mental crisis. Please, y'all. Y'all just don't know. Mental illness is at an all-time high in the African American community. We have more black boys and black men that are committing suicide at alarming rates because they're going through some type of mental illness and they have no one to talk to. You just don't know. One phone call, one text, one message can change a person's whole day. So I do want to say thank you to everybody that tuned in tonight. Don't forget this Thursday, 8 p.m. Central Time. Tap in with your girl. We are going to be talking about ectopic pregnancy. And again, like, share, subscribe, run those notifications up. I am available on all the streaming platforms. Apple Podcasts, I'm on Google Podcasts, I'm on Deezer, I'm on Anchor. Go check out the episodes, leave a review. Let me know what you want to see me do differently. What do you want to talk about on these shows? Again, let me drop and send your emails. blackgirlinterrupted1@gmail.com. Send me an email. Let me know what topics you want to talk about. What are some things that you would like me to bring to the forefront? Even if you want to be a guest on the show, send me an email. blackgirlinterrupted1@gmail.com. I want to again say to everybody, thank you guys so much for tuning in. I love you guys. I definitely appreciate all the continuous love and support that you guys show me week in and week out. But on that note, I love you guys, and I'll see you Thursday night, 8 p.m. Central Time, 9 p.m. Eastern Time.